The idea behind preconception or pre-pregnancy care is that couples who are healthy before planning a pregnancy are more likely to have a safer pregnancy and a healthy baby. Ideally, you should book in with your GP between 3 and 6 months before planning a pregnancy to develop a reproductive plan. This plan will include if and when you want to become pregnant, the number of children you want, and the spacing in between these pregnancies. We'll also go through your general medical history. This is particularly important if you suffer from any chronic illnesses such as diabetes, thyroid problems, or high blood pressure, as these can affect pregnancy. We'll also look at your medications, any prescription medications or over-the-counter supplements, as some of these are discouraged with pregnancy. There's usually a safer alternative that we can switch to. We'll also look at your reproductive history, any previous pregnancies, and whether you encountered any problems. Hopefully we can reduce the risk of these recurring. We'll also discuss your family history, and in particular, any genetic problems that might run through your family. If necessary, we can refer you to genetic services, and we can also discuss the preconception carrier screening test. We'll perform a general medical examination. This will include checking your blood pressure, measuring your BMI, checking your oral health, doing a breast exam, and checking that you're up to date with your cervical screening test. We can also check your vaccination status, in particular paying attention to vaccinations such as rubella and chickenpox and hepatitis B, as it's important to be immune to these before you become pregnant. We'll also discuss smoking and alcohol, trying to reduce your alcohol intake and quit smoking, which we can help support you do. We'll discuss nutrition and exercise and supplements. It's important to be on folic acid and iodine before becoming pregnant. It's also important to book in your partner too for preconception discussion. So book in today with your regular GP to discuss your reproductive health.